My name is Luke Elzinga. I am the Communications and Advocacy Manager at the DMARC Food Pantry Network in Des Moines, Iowa. Looks like we'll have a pretty small group today, so please, if you have questions at any point, just feel free to unmute and ask them. Interrupt me, that's fine, or you can put it in the chat. But without further ado, I will just go ahead and get started and share my screen here. So what I'm going to be talking about today is a report that we put out earlier this year that really looks at the people we assist through our food pantry network and specifically looking at disparities between the people who use our food pantry network and the general population of Greater Des Moines. This is going to be information that's pretty specific to the Des Moines area, but I want to make sure everyone knows, like, there's a broader goal for this presentation to talk about how, you and your own communities could be looking at using data to really highlight disparities and making the case in your community for why these disparities exist and some possible ways to address them. So like I said, feel free to jump in with questions at any time. So all the data in this is for our past fiscal year, so that's July 1, 2021 through June 30, 2022. So a little bit about DMARC. DMARC stands for the Des Moines Area Religious Council. We are an interfaith organization that has been around for 70 years. Our mission is working together to meet basic human needs for the greater Des Moines community. And the primary way we do that is through our food pantry network. So that food pantry network has 15 partner food pantries, 14 mobile food pantry locations, and we also have a no contact home delivery program. Our food pantry network has been around since 1976. And we provide a nutritious 3-day supply of food once per calendar month. And then we also have additional items that are available on a daily basis. A little bit about how we use data. So we operate a shared intake system and database. The visitors that are coming for the monthly supply are asked a series of 12 to 14 questions, depending on there's a couple follow-up questions on certain answers about their household to help us understand the specific needs of the community. Nothing that people answer will affect the amount of food they get other than their household size. It really is to just help us understand. So this data is shared through a data visualization dashboard. We anonymize that data to protect the identities of the people we assist. And we use this data to educate the public, funders, and elected officials about the realities of hunger and food insecurity in our community. And we also use the data to produce a number of reports, including this one. So a little bit about the report. We're often asked what a quote unquote typical visitor to a food pantry looks like. And the truth is, we assist people of all races, genders, ages, education. I really tell people that food pantry visitors look like you and me, your neighbor. You don't know who might be experiencing food insecurity. And this report aims to highlight the stark disparities that exist in every part of Greater Des Moines among people who use food pantries. And I also want to underscore that these disparities are the direct result of historical policies rooted in racism, sexism, and classism, and they are not happenstance. I also want to do a land acknowledgement. Now, this is for Des Moines and Central Iowa. I encourage you to look up in your own area around land acknowledgements, but we acknowledge that we are located here in Des Moines on the ancestral land and territories of the Bakochi or Iowa, Sauk or Sac, and Meskwaki or Fox peoples. This land was taken by force and coercion of white colonizers and the government of the United States. We wish to pay respect to elders of the past, the over 1,000 Native Americans currently residing in Greater Des Moines, and future generations. So the key findings of the report, the first one is that racial disparities among food pantry visitors exist in all communities across Greater Des Moines, but they are especially pronounced in the suburbs. And this really points to the different financial realities between white, not Hispanic people and people of color in our communities, and specifically the suburbs. I know not everyone's going to be familiar with Greater Des Moines, so I might kind of rush through these, but really these graphs just compare the general population of the city versus the population of people who we see using our food pantries. So again, you're going to see that there's some clear racial disparities in every city in the metro area, but are really pronounced in the suburbs. So this is the city of Des Moines. You know, you can see just by looking at the graph the sort of racial disparities that exist. This is the city of Ankeny, which is a suburb to the north of Des Moines. Very white, 91% white, not Hispanic. Among food pantry visitors, we only see about 62% being white, not Hispanic. And especially if you look at Black African American, you can see people who use food pantry visitors are 10 times as likely to be Black or African American in Ankeny than the general population. I really like this graph for Clive. This is another suburb. I really like the graph on the right because it just shows the diversity that we see at our food pantry among food pantry users who live in Clive, but also really shows the disparities that exist. Clive is one of the more wealthy suburbs in the metro area. This next city is Johnston. I think one of the big things here, looking at Black African American especially, you can see the huge disparity that exists, and with other populations as well. In every single city in this study, there were racial disparities that existed for every group that was not white, not Hispanic. I might just kind of skip through some of these because it's the same story we see over and over again. West Des Moines is the one exception where Asian, Native Hawaiian, and Pacific Islander is actually underrepresented in the food pantry visitors that we see. I think a lot of that has to do with the kind of industries we see in West Des Moines and the immigrant populations there. A lot of tech industries that West Des Moines has just a higher population of Asian, Native Hawaiian, and Pacific Islanders who are relatively higher income. Our next key finding is that children assisted by the DMARC Food Pantry Network are more racially diverse, and seniors are much more likely to be white, not Hispanic. And this really just points to the fact that our community is becoming more racially diverse. So these are, this kind of breaks down the race and ethnicity of all the food pantry visitors we see that are children. So you can see about 1/3 of the children that we assist are white, not Hispanic. And then you can see the kind of breakdowns for some of those other groups. This is the graph for seniors. So 70% of the seniors we assist are white, not Hispanic. And you can really see the clear disparities here. One thing I will note, the multi-race category is really low here. And, you know, when thinking about seniors, it's within plenty of people's lifetimes that interracial marriage was illegal in the United States. And so naturally we would see a lot less multi-race seniors. Our next key finding, gender disparities exist across all races and ethnicities. Women are more likely to use a food pantry than men. I do want to note there is no gender disparity among children. The level of disparity increases with age, which you'll see on some graphs in just a second. From a gap of 5 percentage points among young adults to a 16-point gap among seniors. This really points to financial disparities between men and women and the gender pay gap. It also could suggest a greater reluctance to ask for help from men. So here you can see this is a breakdown of everyone who used our food pantry network. Children, you can see there's really not much of a gender disparity. There's slight difference, but really negligible. As we move into young adults, which we kind of define as 18 to 24, you can see that 5-point percentage gap. Adults 25 to 64, it's about 11 points. And then here for seniors, you can see 16-point gap. So the older people are who are using our food pantry, the larger the gender disparities are. Our next key finding from the report, which I think a lot of these were not that surprising. This one was. 1 in 3 households we assisted used the DMARC Food Pantry Network for the first time ever. And it really points to a high level of need in our community. We have seen a big increase in the number of first-time food pantry visitors in Iowa, especially since April, when our SNAP benefits, for those of you who are familiar with SNAP, during the pandemic, there have been emergency allotments going out, which has increased SNAP benefits for a lot of people, but that's tied to the state's emergency proclamations, and our governor lifted the emergency proclamation earlier this year. So starting in April, the average household receiving SNAP in Iowa saw their benefits drop by $200. And since April, we have just been seeing a dramatic increase in use at our food pantry network, both among people who are using the food pantry network for the first time ever, and also people who maybe didn't have to use our food pantries for about 2 years as they were getting those extra benefits. We see a lot of those folks returning. And obviously with the price of groceries rising too, this has just kind of led to a perfect storm. So again, this was our past fiscal year, July 1st, 2021 to June 30th, 2022. About 1/3 of all the households we saw were first-time visitors, and 1 in 4 individuals. So the first-time household had a lower average household size, less people in the household on average, and that's kind of the discrepancy you see there between households and individuals. And like I mentioned, in April, we saw that drop in SNAP benefits, and 35% of all the new food pantry visitors came in April, May, or June of 2022. Our next key finding is looking at income. We don't have any income guidelines to receive food. No matter what your income is, you'll be able to get the same food as everyone else. But we do ask the question just to try to understand better. And 3 out of 4 food pantry visitors that we assist live below the federal poverty line, which, if you're familiar with the federal poverty line, is very low. And I've got a table here coming up that you'll be able to see that. White, not Hispanic people had relatively higher incomes compared to other racial groups, again, highlighting the difference in financial realities. So this graph on the left here, you can kind of see across the bottom, this is household income as a percentage of the federal poverty level. So that that bar on the far left is below 100% of the federal poverty level. You can see it's right around 75%, 73.3%. And then you can kind of see the breakdown there as income rises. But 95% of everyone we assisted made less than 200% of the federal poverty level. And I'm sorry, there's a typo on that table on the right. It should say poverty level, not poverty. But you can see, the federal poverty level is really low. I'm sure some of you may be familiar with the fact that it really has not been updated since it was created. And just an incredibly low amount of money. So to think that 75% of everyone we assist is below the poverty level is really stark. And you can see this table here, kind of the breakdown of what that looks like for different household sizes, both 100% and 200%. This just shows a breakdown by race and ethnicity. The percent of pantry visitors with a household income below the poverty level. And again, we can see some clear racial disparities here. So for white, not Hispanic visitors, it was only about 2 out of 3 were living below the poverty level, or 67%. And then for Black African American, it was about 82%, and other race or unknown Hispanic was at 83%. So again, we see this clear racial disparity where white, not Hispanic, and again, this is relatively higher income, but again, I really want to underscore that, we work with a number of groups here. The United Way's Alice report really says that it takes about an income of 250% of FPL to really meet a survival budget. The next key finding is that more than half of all pantry visitors use a food pantry just once or twice a year. And seniors and people who identify as Asian, Native Hawaiian, or Pacific Islander use food pantries at a higher frequency than others. But there's a bigger story there that I'll get into in just a second. This is a breakdown of the number of monthly food pantry visits for everyone that we assisted. And I think this really points to dispelling some of the myths that we hear about people coming to the pantry every month, just relying on it. That certainly does happen, and especially for people on fixed incomes. But most of the people we see are using the food pantry once or twice a year, and it's really an emergency situation. So 53% of everyone we assisted visited a pantry just 1 or 2 times. And the average number of food pantry visits was 3.6 pantry visits in a year. So this is the graph for seniors, and you can see seniors were much more likely to visit food pantries more frequently. So the average number of pantry visits was about 5 in a year, and 38% visited a pantry just 1 or 2 times. And you can see about 10.5% visited every single month of the year. And this really points to seniors living on fixed incomes, Social Security, whose benefits just are not enough for them to meet their monthly budget, and are relying on food pantries to really help make sure that they have access to the food they need every month. Kind of just forgot I had a slide right here. Another thing I want to point out that 25% of everyone who used a food pantry all 12 months of the year was a senior. This is looking at Asian, Native Hawaiian, and Pacific Islanders, who as a group also had a higher average pantry visit. Seniors and Asian, Native Hawaiian, Pacific Islanders were the only 2 that stood out when we looked at all the different crosstabs. So an average of 5 visits a year, This looks very similar to seniors. 38% visited a pantry just 1 or 2 times, but there's some nuance here. So among adult visitors who identify as Asian, Native Hawaiian, or Pacific Islander, the higher average number of pantry visits is entirely driven by people who are employed or act as a stay-at-home parent or caregiver. And this was another thing that we were, did not expect to see. I think what this might point to is households who have one parent who is working and one parent who is a stay-at-home parent or caregiver, who maybe have more time to visit food pantries. Another thing that we know from looking at our data is this racial and ethnic group was much more likely to have parents who were acting as a stay-at-home parent or caregiver. And we think some of that just may be culturally, especially with refugee communities and larger family sizes, that it's more typical to have one parent working and one parent staying at home. But this is an area at the end for future areas of exploration that I'll mention that we're really interested in doing some follow-up research. Our next key finding is that Hispanic people are less likely to receive disability benefits, Social Security, and SNAP. And this can likely be attributed to documentation status, limiting program eligibility, but also a fear of repercussions for using programs even when people are eligible. And some of that is stemming from the 2020 public charge rule. I'm not sure if people are familiar with that, but that was a rule proposed by the Trump administration that basically said, if you or someone in your household is using SNAP or other assistance programs, that could put you at risk of not being able to receive citizenship status eventually. And that has been reversed under the Biden administration, but I think there's still a lot of fear out there. And we still haven't seen, that sort of increase in a lot of these programs. So this is looking at the percentage of pantry visitors who were enrolled in SNAP at any point in the fiscal year by race and ethnicity. Only about 42% of everyone we assist receives SNAP, which tells us both that there's a lot of people experiencing food insecurity who don't qualify for SNAP or choose not to participate in the program, but also for those people who are participating in SNAP, a lot of them, the benefits just aren't adequate, and they're needing to still rely on food pantries to make sure that their nutrition needs are being met. But you can clearly see for the 3 different categories that we have broken out, Hispanic, not Hispanic, so multi-race Hispanic, other unknown Hispanic, and white Hispanic, considerably lower rates of SNAP participation for those groups. Similarly, this is Social Security benefits. We see that disparity as well. Also see it with Asian, Native Hawaiian, and Pacific Islanders. Sorry, I thought there was one more. Our next key finding is that racist housing policies of the past have lasting impacts to this day. And specifically, we looked at redlining maps from the 1930s and overlaid them with our data from this past fiscal year. The same neighborhoods that were redlined nearly 100 years ago are still some of the areas of highest need today. So this is the red line map of Des Moines, which probably doesn't mean much if you are not familiar with the greater Des Moines area. But I do, for anyone who's not familiar with redlining, I really encourage you to do some more research. There's some great resources out there that have redline maps for a lot of major cities. So I encourage you to look up your own city I think it's the University of Richmond that has this mapping inequality project where you can find a lot of these redlining maps. But essentially, the way that redlining worked was in the 1930s, the federal government established the Homeowners Loan Corporation to help subsidize housing following the Great Depression. But the Homeowners Loan Corporation, or HOLC, basically drew up maps of cities and broke down neighborhoods into 4 different ratings. So A neighborhoods were rated the best, B neighborhoods were rated good, C neighborhoods, which are in yellow, not so good, and D neighborhoods were the worst. And it was very explicit that the racial makeup of these neighborhoods was a key determinant in how those ratings were handed out. And so there's language used around like risky or undesirable populations, not just Black populations, but Jewish populations. I know in Des Moines, this section on the south side, D3, was because of a really high Italian population. And, you can find in these maps from the 1930s really gross racist language around why these ratings were made. But really what this led to was white residents being able to access subsidized home loans only if they were going to buy in white areas, and everyone else being denied. And really this set up communities for failure and has led to the racial wealth gap. And, this is not the only racist policy of the past that has led to these disparities, but this was a very clear one when we were looking at our map that we could point to the lasting impacts of that policy on what we're still seeing today. So among our food pantry visitors who live within the boundaries of that historic red line map, 71% on average lived in a C or D district. And those were districts where people could not receive those loans. And you can see the racial disparities here. So the white, not Hispanic group is lower than average, and other than a few instances, most everyone else is above that average. Multi-race Hispanic is at 80%. And this is so beyond just people who lived in those historic boundaries, because Des Moines has grown significantly and there's other suburb communities. This looks at all of our food pantry visitors. So similar to the last graph, but then we've also added people who are living outside of Des Moines proper and also living in Des Moines but outside of that historic red line area. And even looking at our entire metro area, which that red line map is just kind of a small section in the urban core of Des Moines, we can see that 42% of everyone we assist lives in a C or D district. And again, there's some clear racial disparities here. Multiple groups, multi-race not Hispanic, other unknown Hispanic, above 50%, and white not Hispanic is at 38%, which I also think just points to white flight and white populations moving out to suburb communities. So in conclusion, these inequities are not unintentional, but are by design. As specific federal, state, and local policies were created to advantage and disadvantage various populations in our society. And it's really critical to understand the ways in which previous inequitable policies influence and often negatively impact people's current realities today. So a big part of this report is we didn't just want to provide the information. That was obviously a big piece of it, was educating our community about what we were seeing and the disparities that exist. but we also wanted to look forward and identify some areas that we could reduce these racial disparities. As it relates to policy advocacy, I think there are some opportunities that this report presents, such as increasing access to SNAP benefits and increasing SNAP benefit amounts. Again, during the pandemic, when we saw those additional emergency allotments and people receiving the maximum amount, we actually saw a decrease in the number of people who were using our services. And as soon as those went away, we just have seen it shoot right back up. Another area of advocacy is eliminating barriers to federal assistance for certain groups. Policies to increase disability and Social Security benefit amounts. I do a lot of advocacy for our organization, and we have a really strong focus on SNAP, I think for good reason. But one thing that this report really highlighted is the importance that we also work in other areas to make sure that people are getting adequate benefits and don't need to rely on food pantries. Another piece is requiring minority impact statements on proposed pieces of legislation. And this is something that the Iowa Black Caucus has been pushing for. A lot of these policies had unintended consequences or intended consequences that have really harmed our Black and Brown communities. And requiring minority impact statements on proposed pieces of legislation is one way that before we pass a law, we can really have a hard look at how this law could lead to worsening racial disparities. There's also a number of opportunities for partnerships and outreach. So when we were looking at education, one thing we noticed is that there were a number of adults who had not graduated high school. And we're working with some community colleges on promoting high school equivalency degree programs at our food pantries. We see that as a way to help people increase their educational attainment and hopefully their employment and income opportunities. Another partnership area is providing outreach about SNAP and assistance with applying, especially targeted towards seniors. I think that the stigma that exists around SNAP and food pantry use is especially high for seniors. And so working with partners to try to make sure that we're reducing that stigma and encouraging people to access the benefits that they are eligible for and that they've earned through their whole life as a taxpayer. And then the last piece here is referrals to job training and placement programs, and we're starting some of that with Iowa Works. The next kind of piece here is how can we improve our services, including expanding food selections at pantries to address the wants and needs of a diverse set of food pantry visitors. This is something we already do, making sure that we have culturally appropriate food at our pantries, but we could always be doing better. And so that's something that we're actively working on, working with people who use our food pantries to come up with those recommendations. The second bullet point here is targeted outreach to Hispanic communities to build trust and correct misperceptions about DMARC. One thing that we noticed in looking at these disparities is the disparities were not as great as we expected for Hispanic Latinx pantry visitors. And we think that's because we are not reaching that community as well as we should be. I think part of that is the fact that we have an intake system. And, you know, we do ask for people's IDs, it's not required, and we accept foreign passports and things like that. But I think that is in itself is a barrier. Without that intake, we wouldn't be able to have this information to provide and inform our community. We try to make it as low barrier as possible, but it is still a barrier for people to access our services. And so that's something we're working on, both to see how we can lower that barrier. We actually used to have an ID requirement. Now it's just encouraged, which I still think we have areas to improve there, but also working directly with the community here in Greater Des Moines to do outreach and build trust with that community. And as I mentioned earlier, this report also presents opportunities related to future and further research, including just a deeper dive to better understand the barriers people are facing. As I mentioned, we really try to limit the number of questions on our intake. There's some questions that we're curious about asking, but it's always a balancing act. And so we're looking at conducting an annual survey to ask some of those questions that are not included in the intake process. And again, we're really interested in better understanding the Asian, Native Hawaiian, and Pacific Islander population in some of those pieces I went over earlier. So I know that was a lot to digest, but please, if anyone has any questions, feel free to ask them now. You can find the full report at dmarkunited.org/racial disparities. Actually, we have another short link that's just disparities that works as well. The report itself is really long. It's like 113 pages. But there's kind of the overview that I went over, and it also looks at each specific racial and ethnic group that I mentioned and the disparities that exist for them. There's different geographic disparities. There was a whole lot in the report that we couldn't include and really tried to narrow our key findings. But if you're curious and interested in this stuff, really encourage you to check out that full report. Please feel free to email me with any questions. I'm the report's author, so I'm happy to provide the raw data or answer any questions that you might have. And if we don't have any questions, maybe people can take a earlier than expected break. I'm gonna stop sharing now.
Luke, I do have a question, actually.
Yeah.
So can you talk more about targeted outreach in general? In my personal experience with like benefits and services, folks either feel like really ashamed to receive them. They've had an experience in the past that's made them afraid to come back to receive the services. Things like that, or they don't even know how to receive those services. So can you tell me more about what that outreach looks like and how you encourage people to receive services if they need them?
Yeah, so a couple different ways. I'll say specifically to the Hispanic Latinx community, radio ads on Spanish language radio stations have been effective. For seniors, we partner with a number of senior centers to bring our mobile food pantries there. And I think when it's kind of a community activity that everyone is just going to together, there's maybe less stigma. We also have a program called the Storytellers Roundtable, where we work with people who use our food pantries or use SNAP or are just experiencing food insecurity firsthand, and work with them to, be able to share their stories with the wider community, share their stories with elected officials. We've had one person who's been a part of that now join our board of directors. We're working on creating a community advisory board. In terms of kind of mistreatment at food pantries, that's something we want to be really aware of. So that community advisory board is also going to be kind of, we're not there yet, but the idea is that they will have kind of a complaint board. So complaints will be reviewed by people who actually use food pantries and will help determine the outcomes. We also work with secret shoppers actually to go to all of the pantries in our network just to make sure People are being treated with respect and dignity. And I think another goal of the Storytellers Roundtable is to just let people know there are a lot of people going through really similar things. And I think sometimes the stigma around poverty, people don't feel comfortable talking about with their neighbor about what they're going through, and may not even realize that there's just a ton of people in the community who are going through, obviously not exactly the same thing, but really similar things. And those Storytellers Roundtables have been really powerful in just bringing people together in a room and helping folks realize like they're not alone, and it's not a result of their personal choices that they're in this situation. It's a result of systemic issues of oppression. And I think that has been helpful too in helping break some of the stigma and getting those stories out there and helping people realize like, if you need food, we're here to help. There's no judgment. And there's a lot of people who are going through the same thing that you are. So I hope that answered the question.
Yeah, that was great. Thank you so much. Appreciate that.
Yep.
Does anyone else have any questions?
Well, if you do, I'll put my email again here in the chat. And please feel free to reach out. Check out that full report if you're interested. Again, there's like a lot of data in there to go through. And I really encourage you to think about how you could do something similar in your own community. And it doesn't have to rely on having a full intake. We get a lot of data that way, but there's other ways to do that through surveying, maybe even looking at partnering with like a Master's of Public Health student or someone else who might be working on a research project to help with some of that surveying, because it can be a lot of work. But encourage you all to take a look at your own community, check out that mapping inequality tool and the redlining maps for the metro area that you live in, if you are in a metro area, and encourage you to help inform your staff, community members about disparities that exist in your own community and why they exist.
Thank you so much, Luke. I really appreciate your presentation today. Y'all, I have one announcement before we go. So at the top of the hour, there will be a 30-minute break and then an opportunity to check out our on-demand content in the lobby. We'll then begin a set of 4 workshop sessions that will address establishing healthy connections in child and retailer food health. To join one of these 4 sessions, click workshops in your navigation bar on the left of your screen. You can view all 4 workshops being offered by clicking the blue arrow to the right, then click enter the session. A reminder that one of the upcoming workshops, called Expanding Healthy Food Options at Retailers, will be presented in Spanish today. English interpretation will be available for this session, though. That concludes our workshop. Thank you again, Luke. To exit this session, please click on the red phone icon at the bottom of your screen now, and then click leave. Thanks so much. Thank you, Luke.
Thanks, everyone.